President Trump unveiling a new health care plan aimed at cutting out the middlemen in order to lower drug prices. Lydia Hu is live at a pharmacy in Woodbridge, New Jersey. I was going to say Virginia. There is a Woodbridge, Virginia, with the details. Hey, Lydia.
Yeah. Hey, good to see you there, Dagan. Yeah, that's right. President Trump is calling for legislation. He's offered Congress a framework for his new health care plan, and he spoke about this health care plan earlier just this hour. Listen to what he had to say to reporters here.
It is a tremendous plan. It's called the Great Health Care Plan, and we're going to get tremendous reductions, as you know, through, if you look at medicines and prescription drugs, they're going to come down by numbers that have never been seen before.
And part of President Trump's plan calls for the elimination of the middleman that you referenced, that process of pharmaceutical distribution of how we get drugs from the drug maker to the patient. He wants to get rid of so-called pharmaceutical benefit managers. They're also called PBMs. And Dagan, you know, the PBMs are so powerful. The three largest PBMs manage almost 80% of prescription drug claims in this country. These PBMs decide which drugs insurance plans cover, and they make money by charging fees and negotiating rebates, which are also called kickbacks, from drug makers in exchange for giving certain drugs preferred placement in insurance plans. So now PBMs are accused of pushing drug prices higher because they favor some of the more expensive drugs with bigger rebates or bigger kickbacks for them over cheaper alternatives. And we're here in Woodbridge, New Jersey. You've got reaction from a pharmacist here to President Trump's health care plan. Listen to what the pharmacist has to say.
It's a step in the right direction. What we need to do is actually go after the PBMs, and no other country has to deal with a PBM. And they have to be accountable for all these prices that they're actually bringing on to the customers and to the plan sponsors.
So President Trump says cutting out these middlemen could save a lot of money, upwards of 10 to 15% on average on Obamacare premiums. And Dagan, I should note, for the past several years, we've seen lawmakers from both sides of the aisle proposing legislation trying to eliminate the PBMs from the marketplace. We'll see now if they have President Trump's full backing and even calling for this measure, whether that can finally become a law. We'll follow it. Dagan, back to you.
Thank you so much, Lydia. Lydia Hu in Woodbridge, New Jersey. Steve, Larry Kudlow said this last night, and I paraphrase, that he's been in, when he was working in the White House, he was in meetings, and he could never quite figure out why the pharmacy benefit managers exist. Like, why is they exist to basically siphon money away from the end user of the health insurance, drugs.
Yeah, once upon a time, the rationale was still rationale today, is that with the big drug companies and the poor little consumer, you had to have somebody in between. The somebody in between now has had huge, huge power, much bigger than the drug companies or the consumer. Drug companies now, many of them are starting to sell directly to consumers. I think that is going to go in that direction even more. Transparency, key thing there is removing barriers on health savings accounts and the like, and starting to have employers give people benefit choices the way you do on investment. So your HSA will turn in effect to a 401k or IRA, portable. You don't have to have a policy to be able to buy an HSA. You should be able to do anything with it you want in terms of your health care. You start to do that, you start to get a real consumer market. That brings not just drug prices down, but the whole cost edifice of the drug industry or the whole healthcare industry down. You could cut out, I think Art Laffer is right, over time, you could cut out over time $1 trillion of cost of health care. Doesn't mean the numbers are going to go down, just mean you can get more for less.
I like price transparency in there as well. The White House plan requires providers who accept Medicare or Medicaid and insurers to present clear pricing and increased penalties to encourage compliance. It would also require insurers to post clear information on rates and coverage, company profits and claims paid, and tallies of rejected claims. They also are required to respond clearly to questions about prices. The Committee for a Responsible Budget saying this would mostly reduce overall health care costs. Overall, their plan could save as much as $50 billion.
Larry just wants his Italian restaurant menu. That's what he wants the entire healthcare industry to work like.
Right.
He knows what his cannoli costs. He knows what his ravioli costs. I don't know if he eats ravioli, but that's how we keep. That's what he was talking
There's
about
a
last night.
hospital in Oklahoma called the Surgery Center of Oklahoma, where they don't take insurance, but all prices are posted online. If the cost goes above what they charge you, we're going to charge you, they eat the cost. Everything is transparent. And their costs, even though they're board certified surgeons, excellent outcomes, compare good to well with anybody, about a third of what local hospitals charge. That's what free markets can do if you allow it.
So why doesn't that prevail right now? You know, I hear examples like that, but it's like there's a hospital in Oklahoma and there's one over here, but the vast majority of us don't know about
because it's still
those.
all third party. There's no benefit of saying to you, I can get it for you for less because somebody else is paying for it. So when you have third parties, whether it's employers, insurance, Medicare, Medicaid, you don't have a real market there. And the key thing is getting the power back in the hands of the patient with HSAs, removing the crazy barriers we have in the way. And that way, it should happen soon, because now employees are paying more out of pocket than ever before, because you don't have dollar for dollar coverage on insurance plans anymore. And so you want to know, what is this going to cost?
Right.
And so a market is beginning to emerge.
So the secret to that, and I'll kick it your way, but the secret to that to me is giving the money. If you want that to happen, the patient's got to have the money, right?
Absolutely.
That's why you're talking about, because when I have the money, then economizing on the cost benefits me, actually, and so I will ask those questions.
And providers will provide you with the information on why you should go this way or that way. But right now, it's amazing, all the healthcare ads you hear, nothing about price, because it's all third party.
I'm not going to opine on what the solutions are, because this is not my forte. But I will say this. I appreciate that President Trump is trying to do some things regarding prescription prices, but the GOP needs a larger healthcare reform plan.
Yes.
They need to be able to come up with something that they can try to implement within the next few years to show the American people that they are truly working for them. To just keep saying, we don't like Obamacare, you can say, I don't want this all day long, but you need something better to replace it with. I think these are little steps in trying to do that, but it is not comprehensive enough. And I think this will be a huge midterm issue.
Can I ask you a quick question on that? Do you think it's better to try to go comprehensive, or to try to just get a little bit better step by step? You think you got to go?
You got to blow this up.
Blow it up.
Well, explain it in you might say, a blow-up way.
Because you know what keeps happening? We've been having the conversation about the Obamacare subsidies. We just keep throwing good money after bad because we have
That I agree with.
Even whether it's Medicare or
Right.
your like private employer-provided health insurance, people go to a doctor or hospital. It's like, we're going to do all these tests, and they just go, okay.
Yeah, and this is
okay,
where
'cause the cost
this
is
is where the
hidden.
bully pulpit of the president can be very useful. The president should say, ask your hospital, ask your doctor what it costs. And if they don't have a price, why? Start mobilizing people.
transparency.
Yeah,
Right.
exactly.